My name is Rick Finsterbusch. I'm the CEO of JANZ Corporation located in Columbus, Ohio. We're a service-disabled, veteran-owned small business distributing to the federal government medical supplies. What I would like to talk to you today is about the conference that we're having in Ukraine called the International Healthcare Summit. It's a very important conference because it's the first of its kind since the war, and it has a primary focus on healthcare, everything from pre-hospital, hospital to rehabilitative care. The number of injuries that are suffered in Ukraine compelled me to go over there and look firsthand at what was happening. You know, the people that I spoke to, the people I met with from a healthcare perspective, we found a need to offer a conference to provide a message platform for the many, many people over there that are suffering and the many people that are helping with that suffering. Conference in Kyiv, Ukraine will be there to provide a forum to let people know what's going in the world, especially with healthcare. We have invited physicians, surgeons, subject matter experts in Ukraine to speak at our conference. We've also invited subject matter experts from the United States in various disciplines within healthcare, neurosurgery, anesthesiology, emergency medicine, training, so that we can support their efforts, everything from the pre-hospital combat medics to paramedics, mobile transport, field surgical teams, mobile surgical teams, combat support hospitals, rehabilitative care, intensive care, ICUs, and every facet of healthcare.
Awesome. Do you want to touch on the field trips portion of the conference?
Yeah, while we're there, we're going to get a chance not only do specific breakout sessions working with topics like pain management or anesthesiology or neurosurgery, reconstructive surgery. We're also going to have a chance to visit some of the facilities in Ukraine that treat these patients firsthand, to work with these people firsthand, these people that are just there in Ukraine's greatest time of need, and get their perspective on it, whether it's visiting with a military hospital, or whether it's meeting with a civilian hospital, whether it's meeting with a rehabilitation center. All of these places that are intertwined, we're going to have a chance to meet with the folks that are making a difference firsthand, whether it's people that have worked in forward surgical teams or people that have worked on the front lines handling patients, or whether it's been in hospitals or reconstructive areas. Well, I think the most important part of this entire conference is the message. People need to understand what's happening in Ukraine. Every single day we hear about the conflict. It dominates news coverage, you know, all the giving, you know, the arms, the battles, but one of the focuses hasn't been on healthcare. The number of amputations that go on within Ukraine, the devastating injuries to children, you know, the indiscriminate bombing that goes on. It's important to understand that there are people that are being injured, and the volume of healthcare and the volume of surgeries that are happening are taxing the resources within Ukraine. And these people need our help, whether it's through collaboration, whether it's doctors interfacing with each other, exchanging ideas, talking about the techniques and, you know, that help save lives and improve patient outcome. This is what needs to be done. These are not normal circumstances. Modern warfare at its ugliest, with the most modern weapons that are having an impact on people's lives. this messaging needs to go out so that everybody understands what's going on, how it could impact the rest of the world, and how these very special people and doctors and physicians are dealing with the most unbelievable circumstances when it comes to healthcare and what they're doing about it. So we've enlisted people, we've gotten access to some of the highest people, the highest level of physicians that are in Ukraine, and their colleagues in the United States, around the world, are needed in this collaboration because there are lives being lost every single day. And it's an event that has to happen, and it will happen because it's something we have to do. We have to create the forum where people have a chance to talk about what's going on, and there has to be an opportunity for people around the world to respond, to see how something they're doing can help save lives. Yeah, I think JANZ is involved because we are a medical device distribution company, you know, the heart of healthcare. And we decided a long time ago, I was watching a news article about a woman who was in a bunker with her 5 children and trying to figure out, completely devastated by the circumstances involving the invasion. And I decided at that point that now it's time to do something. It's easier to watch these things happen and unfold in the media and go on about your life, but it also compelled me to enlist the resources of my company and all the special people that work for JANZ, who also saw the opportunity to help out. We went there to look at what was going on, and now we're putting this conference together along with August Mission so that we can make a difference. We're not a large company, we're a small business, a service-disabled veteran-owned small business. And everyone in the company is enthusiastic about what we're doing, and we need to be part of this. We're not a large organization, but we're a small company with a big heart. Yeah, being there physically is a life-changing event. It really changed your perspective on the value of human life and the sacrifices that people give in order to ensure that they protect their own freedoms and their families. You know, so being there firsthand to see exactly the impact of this, going to places like Unbroken, or seeing some of the hospitals over there, it's important to be able to understand what's happening, the impact on these people, and the resiliency and the fight that's in these people. So being there, I saw that firsthand, and it made an impact. Not that I needed to do something, not that I should do something, but I have to do something. There's no part of me that can't be involved in this anymore. For me, it's not whether I want to do it or whether I should do it. I don't have a choice in the matter. I have to do this right now. So that's the impact that it has on you.
That's awesome.
Through our conference and our exposure to the doctors in Ukraine and the collaborative effort in the United States, we're asking people to be involved, whether it's helping us financially to put this conference together, or our support through either donations of medical equipment or supplies and things they need at the field. There's not a lot of money to be able to be spent from the people over there because they're defending their country, and healthcare is a very important part of stabilizing that effort. It's interesting to watch people that have lost limbs on the front lines and then several months later back on the front lines because they're still able to defend their country, and freedom isn't free. There's a very expensive cost to being able to run your life and, be free. And we need to support that. That's the very nature of who we are. And I think there's a lot that can be done, even not associated with medical care, but a lot that can be done by helping us put together the forum for the message that needs to be broadcast and that can help one single life. This conference is so expansive at this point, and it touches a lot of points in the various echelons of healthcare. But more importantly, if we impact one life, we have made a difference.